Today we're going to talk about nursing informatics in your basic nursing thinking, doing, and caring textbook. This content is in chapter 45, and this chapter is an online version only, so you will need to log in to FA Davis to get these resources. In today's increasingly complex and ever-changing environment, we need healthcare professionals who are competent in the use of information technology to communicate effectively with the healthcare team, patients and families, and then gathering and managing information, supporting clinical decision-making, and to reduce the risk of medical error. Nursing informatics and healthcare technology help the nurse work more efficiently and support safe and innovative nursing practice, which leads to improved patient outcomes and higher quality care. Electronic communication is also part of this equation. Informatics has been defined as managing and processing information necessary to make decisions. The American Nurses Association defined nursing informatics first in 2008 as a specialty that integrates the three components in the picture: nursing science, computer science, and information science, to manage and communicate data, information, and knowledge in nursing practice. Nursing informatics facilitates the integration of those elements to support patients, nurses, and other providers in the decision-making roles in all settings. This support is accomplished through the use of information structures like an electronic healthcare record, information processes, how we use those structures, and then information technology, the pieces of equipment. There is a certification and graduate education within the nursing profession with a focus on informatics. Nursing informatics can be applied to all areas of nursing practice, so this specialty is beneficial in clinical practice, administration, education, and research. Essentially, the informatics specialist looks to improve processes, which will improve patient outcomes. And some specific areas where this is beneficial would be patient safety, like medication administration and clinical documentation. If you think about when the chart prompts you about checking the potassium level before giving a medication or checking your platelets before administering a different medication, those are ways that informatics has helped improve our safety regarding medication administration. It has improved workflow by ensuring the display of information and processes across the continuum of disciplines and coordinating how nurses work, so I can see what was done on a different day really easily utilizing these tools. It allows for continual evaluation of an electronic healthcare record, and this could be designing a new system or enhancing the current system within a facility to improve effectiveness and ease of use. Ideally, this would include involving all the stakeholders who are using an electronic healthcare record, and all nurses, staff nurses, charges, anybody using electronic healthcare records should be giving input into ways to improve data collection and then the sharing of that data. Also, informatics will be a way to provide education for new and existing staff. I know at St. Joseph's we use HealthStream to get our continuing education credits. We used to have to carry around the basic skills textbook to get the policies and procedures, and now all of that can be obtained through the electronic database, the intranet or the internet. A nurse who wanted to specialize in informatics would need skills in the clinical setting, so they'd need to have competence in the clinical setting, patience, and interpersonal skills, being able to communicate with interdisciplinary teams, being willing to listen and have some strong problem-solving skills. A nurse informaticist would need to be flexible and have the ability to do some project management skills. Basic definitions and an understanding of how nursing informatics works within the healthcare system is essential to utilizing technology effectively. The elements of informatics include the 4 components on the screen, and this is definitely test question material. So data is raw, unprocessed numbers, symbols, or words that have no meaning by themselves. These are primary facts and observations acquired when providing services. An example would be a blood pressure measurement or a fact like father died of prostate cancer. Information is groupings of data processed into a meaningful and structured form. Knowledge is then formed when data are grouped and creating meaningful information and relationships, which are then added to other structured information. Knowledge can be either previously known or new, which helps make informed decisions. The nursing informatics scope and standards of practice define wisdom as the appropriate use of knowledge in managing or solving human problems. It's knowing when and how to apply knowledge to deal with complex problems or specific human needs. And that was in 2015. Wisdom develops as an outcome of your clinical experience, theoretical knowledge, critical thinking, and intuition. So as you progress from novice to expert in the practice of full spectrum nursing. This slide is a good picture or infograph of the hierarchy of the elements of informatics. So we start with data and move up to wisdom. And on this slide is a picture from your textbook, which shows how the 4 components work in increasing complexity within interactions and interrelationships. So an example would be 110. What is 110? This is data, right? It's a number. If I tell you 110 over 60, and this is the patient's blood pressure, it becomes information. If I tell you that the client is an 88-year-old man with a history of hypertension, and I combine it with information about anatomy and physiology, pharmacology, pathophysiology, it becomes knowledge, and it's used to decide about further care and treatment. Wisdom is then putting the knowledge into practice and being able to utilize it appropriately in different situations. The healthcare of your clients is largely dependent on information, not just numbers, but pieces of data being combined. Every action taken depends on previous information and knowledge. The delivery of healthcare requires information about the science of type of nursing or type of care, the patient or the client, the provider, outcomes that are like what we're seeking and what are known or positive outcomes or what are negative outcomes even, and then the processes and systems for delivery of care. Let's practice a test question with the content from the previous slides. The student nurse has completed a research paper detailing the pros and cons of a medical ethical issue. This paper reflects which elements of informatics? Your choices are wisdom, information, data, and knowledge. I always recommend rewording the question before moving forward with an answer. So I read the whole thing and then I would restate the question like this. How could I define the pros and cons of an issue? The correct answer is knowledge. A research paper written by a student would consist of new knowledge about a topic that's created when the student gathers and groups that data. A textbook would generally be providing information, but this is a written component of data by a student.